My name is Sara Archie, and I'm the Complex Injury Nurse Case Manager at MEMIC. I work with injured workers, so people that are injured at work, to help them work through the different issues they may have with their injuries. I work with the most catastrophically injured, so people that have injuries such as major head injuries, someone who has a spinal cord injury and becomes paralyzed, someone that has major burns, or someone that may have become blind from their injury. And I work to kind of navigate them through the different parts of their treatment. Following their injury, I assist them getting equipment they may need, transportation services to their appointments, and I kind of communicate all that to the claims handler or the employer, so they're up to date on what's going on with that injured worker as well. I spend a lot of my day on the phone with injured workers, kind of calling them after appointments, and just checking in with them to see if they have any needs, if they need any equipment, any transportation, if they're having issues with their provider. I can help advocate for them. And I basically spend a lot of my day on my phone with them. I also do medical cost projections for the company here. So I work to establish what the cost may be for different injured workers' care throughout their lifetime, so that the claims handlers here have a idea on what they need to set for money for the claim. I am lucky that I get to work with people for a really long period of time, just because they do have such significant injuries, and do require their treatment course is much longer than someone that had, more minor injury where they heal and go back to work after 3 to 6 months. The people I work with may never go back to work because their injuries are so severe. And so they do need someone to help them kind of navigate through their treatment and what their needs may be. I'm lucky that I get to go out and take, as I call, a field trip from time to time, and I get to go meet my injured workers. A lot of times after they leave the hospital following their injury, they need to go into some type of acute rehab facility so that they can continue to get better. It's kind of that interim between the hospital and home. And I'm able to go kind of meet with them and introduce myself, kind of let them know what my role is and the things that we can do here at MEMIC to help them. I also recently got to take a course over the past about a year ago, to get my certification in nurse life care planning, which has helped me with those medical cost projections that I provide for the company. So that was kind of an interesting thing that I didn't really anticipate that I would get to do when I started my job here at MEMIC. I never really anticipated doing this. From a young age, I knew I always wanted to be a nurse, but I always thought being a nurse meant taking care of patients in a hospital setting. I never really thought about the different avenues that a nurse can take. And I did start my career in a hospital, taking care of patients. I, started in a more basic medical floor, and then I worked my way up into an ICU and an intensive care unit, open heart unit. So different units, emergency room, and all of those have kind of helped get me to where I am. I really, as I said, it's not something I anticipated doing, but I do actually really enjoy it. I enjoy building those relationships with injured workers. I enjoy kind of helping them work through issues when they arise, trying to think outside of the box to get people what they need to help them heal and get better, or even to simply live their everyday life if they've been really severely injured. So my role definitely requires critical thinking skills, thinking outside the box to get people what they need. I think every injured worker is different, and they need different things. So on a daily basis, we definitely need to think outside that box and work through those things. Also, being organized has really helped me be successful in this role. The day can get kind of away from you, so you really need to be organized and make sure you get the most important things done, in case other things come up, because things are always coming up. I think patience has been really helpful as well. People have a lot of challenges and with these work injuries, and just being patient with them and kind of working through whatever may come up is really helpful. And being a team player too, I would think our department is really good at working together. Different nurses bring different things to the table, so being able to, realize if you're not getting a good answer for an injured worker, you can work with your colleagues to try to figure out, maybe they might have some expertise in that situation. I just really enjoy, honestly, working at MEMIC. I enjoy working with the different departments. I think as a nurse, you really do get to work with lots of different departments here at MEMIC. You know, I work with the claims handlers. I get to work with the legal department. I'm working with communications today. So I think we really get to work with a bunch of different departments, and just, you know, I never really expected as a nurse to do this type of work and to work with so many different types of people and careers. And it's really rewarding and challenging, and you know, just to be doing these different things. If you're thinking about nursing as a career path, I think it's really important not to box yourself in and realize that there's so many different avenues that you could take with your career as a nurse. I think definitely getting a strong foundation is good. And I'm really glad I learned from a hospital setting, but I'm also really glad that my career has taken me in a different path too, and I'm getting to learn different things. So I think that I guess there's no correct route. Being being in a hospital doesn't make you a nurse any more than in this type of a role. So I think just being open to new opportunities and being able to use your knowledge for different types of jobs is really important.